So today we're going to talk about the infectious disease cycle and lay out the basic concept of biosecurity. So if you're a doctor in veterinary medicine, if you're a specialist in animal science, if you're a production operator or a production manager, a lot of these principles will be familiar to you. And what I want to do is I want to lay out those basic concepts so that when we talk about cleaning and disinfection and the role of cleaning and disinfection in biosecurity, you have a better understanding of why some things are so. So let me go into the infectious disease cycle. So the cycle actually has 4 key elements. The first element is a route of entry of the infectious disease into the susceptible host. The second element is once the infectious agent is inside the host, it will look to replicate itself. Now that could be replication within the host, or it could be replication within a system of hosts. The third element is there will be an exit point. The infectious agent will look to exit the host with the objective of infecting other susceptible hosts. And in doing so, it allocates itself in the environment, which is our fourth point in the cycle. There is an element of environmental persistence of the infectious agent. Once a susceptible host encounters that infectious agent in the environment, there will be the first element again, which is the entry point, and that completes the cycle of infection. So I want to talk about the routes of transmission now. And we're going to look at routes of transmission in 2 ways. One is a very general description of the routes of transmission, and the second one is a more practical view of the route of transmission. So if you look at the general description of the routes of transmission of the infectious agent, you basically have airborne transmission, you have droplet transmission, and you have contact transmission. Airborne transmission, you can imagine, is when you have the infectious agent carried by, let's say, a convective current, and it infects a host that is located several feet or meters away by a convective air current. Then you have droplet transmission. Similar to airborne, you have the infectious agent or a high number of infectious agents in a droplet of contaminated fluid. And it could be something like mucus, it could be something like liquid feces, or any type of droplet dispersion that is small enough to be actually carried by convective air currents. And then you have transmission by contact. And that could be by direct contact, or it could be by indirect contact. By direct contact, you can imagine it's the transmission between 2 animals that are contacting each other directly. By indirect contact, as the name describes, is an animal that comes in contact with a contaminated object. It could be an instrument, it could be a surface, and acquires the infection through those indirect means. Now, if we look at the practical way of classifying routes of transmission, we look at several. We look at fecal-oral transmission. We look at transmission by fomites, and that's where you have an inanimate object that is contaminated with the infectious agent, and that comes in contact with the host. We could look at vector-borne transmission, where you have some other intermediate agent that carries the infectious agent. So, for example, you could look at flies, you could look at mice, rodents, birds. Then we have waterborne transmission, which is self-explanatory. That's when the infectious agent is, for example, in the water that the animal drinks. Sexual transmission, again, self-explanatory. You have vertical transmission, such that when you have it from a mother transmitting the infectious disease to their child. And then you can have laterogenic transmission, which occurs when we are, for example, performing a procedure on an animal and we're using instruments that haven't been disinfected or are contaminated with the infectious disease.